Welcome back to The 9. This is National Suicide Awareness Week. All this week here on The 9, we're hoping to raise awareness about what can be a delicate topic by speaking with a number of experts who work to prevent others from taking their own lives. Joining me this morning, Dr. Descartes Li, a psychiatrist with the UCSF Depression Center. Thank you for joining me, Doctor.
Sure thing. Can
you first explain what is depression and how can it manifest in different people?
Oh, depression is a psychiatric or mental illness that strikes many Americans. Most commonly, people will be sad or feel socially isolated or withdraw socially and have low energy, poor appetite, poor sleep. So there are a lot of signs of depression that I think people are pretty familiar with, but it's good to go over them again anyways.
When it comes to the critical signs, certainly we've seen our loved ones in periods of trouble. What might we hear or see that should be an alarm for us?
Big alarm flags for me are things like if the person's like extremely hopeless or they engage in like reckless behaviors, whether sometimes they will cut themselves or hurt themselves or just using drugs recklessly. If you notice that they're preparing to do things like give away their belongings or buy a gun or hoard lethal medications, things like that. And certainly if someone talks about the future in a very negativistic way and there's no future for them or things like that.
A lot of us might try to help that person feel better, cheer them up. What about doing the opposite and actually asking, are you thinking of harming yourself?
Oh, definitely. You definitely should ask. It's very common that people have serious thoughts of suicide. I think studies show like 1 in 8 Americans at some point in their life will say that they have thought about suicide seriously. So I think asking about it is really critical.
You're not giving that person the idea?
No, you won't be introducing the idea. I mean, it's so much of a part of our culture already, so it's not as if people haven't already thought about it if they're seriously depressed.
And what if you as a confidant is asked to promise not to tell? Is that a promise we should keep?
I would say no, but it's a tricky question because you want the person to feel comfortable talking to you. Something that I often say is I'll do my best to keep matters private, but if I think someone might get hurt, I'm going to do my best to prevent that.
A lot of us, Dr. Li, have been talking about suicide after the recent deaths of people such as Anthony Bourdain, Kate Spade. Do such high-profile deaths raise the likelihood of suicide in the general population?
There is a phenomenon called copycat suicide where the suicide of a famous person or a celebrity can trigger other people to mimic them or do the same thing, and kind of gives people, I think, a feeling of permission. So we definitely should be aware of that phenomenon.
I know suicide rates have gone up some 30% in the past 20 years. What do you attribute to that?
Oh, there are probably a lot of things that go into that. One is like better surveillance. I think decades ago people would be really reluctant to put down someone as a suicide when they may have been, but it was maybe kind of an accident. And then also access now to means where, you know, opiates are much more prevalent and they can easily be lethal.
And finally, with all your medical background, so much of what I've read, Dr. Li says, trust your gut. If you think the person is going to harm themselves, then you need to act. Do you sometimes go back to that gut feeling as well?
Oh, definitely. Sometimes people, what they say matters, but of course, but how they say it is really critical. So your gut feeling about how they might say whether they're suicidal or not is super important. I would trust that, definitely.
Okay. Coming from a doctor as well. All right, Dr. Descartes Li with the UCSF Depression Center. Thank you for joining us this morning.
Thank you.
Of course, of course. And if you at home know someone who needs help, someone to talk to, the number to the National Suicide Lifeline is on your screen. We also have more information for you on ktview.com in the web link section.